Hawaii Medical Center is already beginning to shut down tonight. The closures of both the East and West hospitals comes as a deal with a potential buyer falls through. KITV4's Shane Enright joins us now with the latest. Shane?
Well, tonight, Laura, the city says the emergency rooms at both hospitals are no longer accepting patients. Employees of both Hawaii Medical Center West and East hospitals learned of the devastating news this morning. Nearly 1,000 workers are losing their jobs.
We're just going to have to wait and see. I mean, I have other plans, but I really like working here.
In an emailed statement released to KITV, HMC's CEO says, the potential buyer, Prime Healthcare, had presented a preliminary bid to purchase the hospitals. However, because the intended offer was less than what was owed St. Francis, our largest secured creditor, St. Francis filed a motion earlier this week objecting to a potential sale, without being able to credit bid the nearly $40 million they are owed. Prime Healthcare was not willing to proceed with the sale, knowing it could not exceed the St. Francis bid.
This is the only hospital that's on the west side. What's going to happen to all the folks down in Waianae? They can't drive to Palimomi. That's kind of ridiculous. What about the ambulance?
Both hospitals are expected to completely close within a month, Laura.
Wow, all right, thanks a lot, Shane. Well, the director of the City Emergency Services Department is calling the shutdowns a crisis for the community. But steps are being taken to provide care in the event of emergency. Our team coverage continues now with KITV4's Catherine Cruz. She is live at Hawaii Medical Center East. Catherine?
Well, you know, medical crisis is right. I just got off the phone with the head of the Healthcare Association, Toby Claremont, and he has confirmed that the emergency room here, the word that he's getting is that the emergency room here on Liliha will be closing down at around 7 o'clock tonight. So they will start that process here, and that's, you know, within an hour. The whole idea of diverting ambulances is that they basically can't accept any more patients. They've got about 20 here and about 50 over at Medical Center West, and they've got to be moved to other hospitals, so that's really key. But I did talk to Ireland, and of course the most important thing, Dr. Ireland says, if there is a medical emergency, you should call 911. And the idea is that they will then transport you to the nearest hospital to get you emergency care as soon as they can.
Could be Palimomi, maybe Kaiser, even Tripler, or even the downtown hospitals, depending how busy those other hospitals get, and also depending on the condition of the patient.
Now here's the deal. Dr. Ireland says that they will have 2 ambulances on standby, one in Makakilo and one in Ewa. The station also in Nanakuli, which normally shuts down at 11 o'clock, will be running 24 hours. And we're also told that they're also talking to the private ambulance services because in order to deal with the 60 patients that are at these various hospitals, they're going to need ambulances to transport them to wherever the team decides is best for those patients. And it's got to be a doctor-to-doctor thing. There've got to be doctors who will accept the patients here to wherever, Queens or Palimomi or wherever it may be. So that is the very latest, and we will have an update for you coming up at 10.
A lot of people needing those reassurances. All right, thanks a lot, Catherine. Queens Health Systems released a statement about the closures and concerns about the future of the organ transplant program. It said, in part, if Hawaii Medical Center is not able to continue this vital program, we will take a strong look at seeing what Queens can do to preserve it for the people of Hawaii.